Thank you, Mr. Chairman, and thank you, Dr. Romer, for your testimony. Part of the discussion and part of the intent, based on the President's frequent comments, and I think there's bipartisan agreement, we have to control the cost drivers in medicine. Can you touch on that?
I mean, absolutely. I mean, we have seen, I mean, again, the numbers are just incredibly clear of how costs are rising over time. And we do think it has to do with a lot of how we have structured the system, that we do have payment systems that tend to reward volume over value. We have a system that tends to reward technological change that is cost increasing, but not technological change that's cost saving, right? And all of those things are important.
Well, you know, in terms of cost drivers, there's a utilization component. Too many tests ordered, too many of in that regard. Can you touch on that as well?
I mean, yes, we certainly do think that there are duplicative tests and things like that that can be important. We do, when the studies that have, for example, looked at the difference across states in Medicare spending do find that it's often quantity, not the price, that is much higher in some areas than others. That's again, that then feeds in. Our report very much talks about that as one of the drivers. And then how do you fix it? Well, part of the way that you fix it is perhaps to bundle care so that there's one provider sort of looking at the whole chain and making sure that there aren't duplications and things like that.
And there's also defensive medicine being practiced. You have doctors that are ordering tests, even though they believe they have the correct conclusion, for fear of lawsuits. And that's been a component and a large discussion in my state of North Carolina and in certain states around the country on liability insurance for medical providers. And that tends to be a significant cost driver. There have been various studies, and I'm sure you're very familiar with it. But I haven't heard and I haven't seen proposals from the administration on limiting medical liability and bringing the cost of medical liability down.
We touch on defensive medicine as one of the things that can matter in our report. The President has also mentioned it in his AMA speech. I think
A passing glance.
He did come out and say that it was something that he understood was a possibility. He has certainly has expressed views that is not willing to put caps on awards.
Why no caps?
But he has very much talked about ways that we could make a middle ground of talking.
Why no caps? We have a number of different bits of evidence. Oregon is a model for a state pre-cap, with caps, then caps revoked, and the cost drivers significantly, the cost of liability insurance for those practicing medicine jumped severely after the caps were removed. Do you disagree with that evidence that caps absolutely have an impact on the cost of liability insurance for medical providers?
It will, of course, there are, of course, trade-offs. And what the President has described is he's worried about fairness to people that have been harmed. And that's part of what he certainly mentioned in his speech of why he was not in favor of caps. But he is very much in favor, and it fits so much into the research on what works and what doesn't. He's very much in favor of doctors saying, let's establish better protocols so that we have a presumption on what's reasonable, and so that's a way to help, again, get to a middle ground.
Well, you know, in terms of the developed nations around the world, we pay the highest price as a percentage of our GDP in lawsuits of any country in the world. 2% of our GDP goes to lawsuits. Isn't that a significant driver of healthcare? Shouldn't that be in a holistic approach if we're going to talk about everything? Shouldn't that certainly be on the table, caps on lawsuits?
Certainly, there's a lot. I mean,
we could just stop with certainly.
No, there is evidence across countries, of course, of very large differences in spending in general, and a big part of thinking about how to reform things is figuring out what those sorts of differences are. The President has identified a number of things that we think can slow the growth rate of costs. that don't go to the things that you are talking about.
I've
We
read
think
free-
absolutely will work.
I've read, just as a parting glance, Mr. Chairman, I've read significantly, there's been a number of stories about the Safeway model of what they've done to control health care costs. Has that been a point of discussion within the administration?
It certainly has, and it certainly gets to some of what Mr. McGovern was talking about doing innovative things to reward wellness, and that is something I think many people agree on are things that encourage prevention and wellness are an important part of cost containment.